Hello! Today we will be discussing preschool readiness, identifying and building prerequisite skills for young learners. Our presentation has been created by the clinical team at Early Autism Services and the Kalamazoo Regional Education Service Agency. Together, this team of providers from different therapeutic and educational disciplines will provide a comprehensive overview of skills that will strengthen a child's success in a preschool classroom. Our contributing panel of professionals are Jenny Lorca, Chief Clinical Officer at Early Autism Services, Jen Sova, Program Administrator of Early Intervention and Special Services at KRESA, Nora Wood, Early Childhood Special Education Teacher and Early Interventionist at Kalamazoo RESA, Chrissy Shank, National Speech Language Pathologist Lead at Early Autism Services, and Morgan Hanna, Occupational Therapist Lead at Early Autism Services, Nashville. The following is a brief review of our agenda of topics that will help guide you with ideas to get your child ready for preschool. We are going to talk about how applied behavior analysis can support your child in the home or in a clinic space. There are many things that ABA providers can do to teach your child the basic building blocks that can assist them in getting more from their other therapies. We will discuss the core skills required for preschool that children should be working towards. We will also dive into the continuum of services that your child can access and how these services can help develop their necessary skills. Our team has outlined strategies they will use to teach children essential skills they need for preschool success. And finally, we will present some activities you can do at home that are a fun way to support your child as they build valuable learning skills. ABA therapy can be provided at home or in a clinic and is very effective in teaching children some learning to learn skills that will set the stage for them to pick up on even more opportunities in their natural environment and in other therapies. When we say learning to learn, we mean that these skills are baseline level skills or building blocks that can help kids become more aware of their surroundings, ready to take in information, or have a basic understanding of following instructions. Attending or focusing for any period of time can be challenging for a child. Many children have a hard time sitting in one place for longer than a few seconds. We meet kids where they are and find out how long they can sit for a preferred activity. Even if they start off at 5 seconds, we can shape that into longer and longer periods of time by inching that time up slowly, even by 5-second increments, until they can sit for an appropriate amount of time for school. Orienting their body towards a speaker while they're providing instruction is also a valuable skill to learn. This can help kids show their instructors that they are available for instructions and ready to respond. Waiting for a turn is also something we spend time teaching during our therapy sessions. Waiting for a turn can be for a turn with a toy, or for some of our learners, this could be for them to gain access to someone's attention. One of the most important things that our BCBAs help families with is decreasing maladaptive behaviors or any behaviors that are a barrier to learning skills in the child's environment. We come in to do a functional behavior assessment, which entails watching closely what happens right before or after an undesirable behavior, so we can determine the function of the behavior. If you're interested in learning more about the ABCs of behavior and determining function, we have a great self-guided presentation in our resource bank for you to watch. So we focus on teaching imitation skills, including ones that our speech, occupational therapy, and early intervention partners would also teach, such as gross, fine, and oral motor movements. This helps children learn to watch their peers or adult models to guide what they should do as well. Finally, we do attempt to collaborate with other outside providers so that we can learn how to generalize those skills into the child's home setting as well. The more time they get to practice, the better. Early intervention program leaders designed systems for instruction to support building foundational learning for our youngest students. These broad skills are areas targeted as building blocks for academic success. Independence. We want a child completing tasks on their own. Building functional communication, or using words, sounds, signs, pictures, or behaviors to express ideas, thoughts, or feelings to someone else. Social interaction, or the exchange of purposeful communication between two or more people used to build relationships. Meaningful play, which involves working with materials or toys in a purposeful way. Learning through imitation. Children learn from modeling. We want to build both motor and verbal imitation to support the ability to execute purposeful motor movement and speech production. And learner behavior, which is a desired behavior we work to develop for active participation, engagement, and appropriate responses in a structured setting. Each state provides early intervention, but the access to each system is slightly different. Your state government agency has an education webpage, which provides a website and phone number to direct you. Pediatricians should also be able to provide that information at well child visits. Early intervention programs serve children from birth to kindergarten. Services are provided for infants and toddlers in home and community care settings to support parents and caregivers with skill building in the routines of the day. Early educators work on all areas of development and support the smooth transition from birth to 3 to preschool programs. Depending on the areas of need and significance of the impairment, children receive specialized services in a special education program in a separate setting, or they can be supported in general education, depending on a community's resources. As educators, we work to support children in natural settings like preschool and childcare programs, but given the level of need, many of our students require more intensive intervention and therapies to build foundational skills before generalizing to a group setting in general education. In early intervention, we use a parent coaching model to support parents in their child's natural environment. We believe strongly that you, as your child's parents, are their first and best teacher. We use routine-based approach to help you embed strategies within your daily routines to set your child up for success. We're going to highlight some of the activities and approaches that we use, but it's important to mention that as parents, you are already utilizing a lot of these approaches to get your child ready for school, perhaps without even knowing it. So some of the pre-learner skills or behaviors that we work on are the following. A focus on developing functional communication, which has a heavy focus at the beginning to help parents take a step back and do less anticipating of their child's needs. Observing the child and what they're interested in and waiting for their child to attempt to initiate a need through eye gaze, gestures including pointing or reaching, signs, or verbal attempts and approximations, and then coaching the parents to recognize these attempts and interpret their child's attempts at their first initiation in communicating a want and need. Joint attention is another focus. Joint attention is being able to jointly share in an item or an activity together. Many times when working on joint attention, we emphasize the importance of playing with children, getting on their level, eye to eye and nose to nose, and being directly involved with an item or an activity that the child is engaged in. This joint attention leads into being able to attend to an activity with a familiar adult for an increased amount of time. We know that in preschool or in any school setting, our children are going to have to interact with other adults and then eventually other peers within their environment. And so you, as their parents, are their first and best teacher, and they are going to interact with you for a sustained amount of time before they interact with other adults in their life for a sustained amount of time. During these same activities where we are focusing on joint attention and sustained one-on-one attention with an adult, we are also working on developing taking turns. Coaching parents in noticing when their child is initiating for a turn and what that might look like, and then coaching them on waiting, but then when it's time to insert themselves to take a turn. And children really benefit from that back and forth exchange. It leads into further developing of understanding communication. These small steps during playing with your child and turn taking lead into bigger steps preparing them for when they are able to participate with peers in an education environment. Then we will take it a next step further and coach the parents on how to present a non-preferred play activity with their child. So the parents are choosing an activity and it's not one of the child's preference, but it's an important skill for children to sometimes be presented with something that they wouldn't choose. This will set them up for being able to follow through with tasks and directions in a classroom-type setting with other peers. Some of the cognitive skills that we focus on that are big important steps for classroom readiness are attending to books. Those pre-literacy activities at such a young age really do need to focus on the book itself and not necessarily reading the entire story. Thinking of things like, can your child orient the book so that the pictures are facing the right way? Can they turn the pages? Will they allow you to sit with them, touch the pictures, listen to you name pictures, or talk about the pictures? Songs and figure plays are huge. Working on picking out simple songs or slower songs and finger plays that contain motor movements. Repetitive songs are very good for building language and imitation because it provides kids with many opportunities to practice the same movements and words. Can your child begin to follow along with some of the motor movements in the songs? Are they catching on to the tune of the song or attempting to imitate some of the words or word approximations? Working on some matching skills and problem-solving skills in these activities allow children to explore and attempt things on their own. Coaching parents on how and when to model for their child is in this process. Language is a huge part of the preschool classroom. For children with autism, we know that learning language can be very challenging. Understanding what language includes and way to incorporate development at home can help the child become ready for classroom learning. Expressive. Expressive language is our ability to express our thoughts and ideas, including all of our wants and needs. This includes vocabulary, length of utterance, grammar, and the overall content of the message. The important piece here is making sure the message is clear for the communication partner. Receptive. Receptive language is our ability to comprehend the meaning of the word as well as how the words relate to each other. This requires listening, understanding vocabulary, following directions, learning categories, functions, and understanding the meaning of sentences. Pragmatic. Pragmatic language is the social language we use in our everyday interactions. This includes our ability to understand nonverbal communication, such as eye contact, body language, facial expressions, or gestures. Determine what to say and how to say it, have conversations, and decide what is expected behavior in any given situation. This is especially important for our young learners. Understanding social skills helps children grow in the ability to learn from peer interactions. All three of these areas of language are a part of language development. At times, for children with autism or any language delay, one area of language may be affected more than another. An example is The child might understand what is being said, but have difficulty expressing thoughts and feelings independently. The child might be extremely verbal, but have difficulty following one-step classroom directions. All of these areas are taken into consideration by the speech-language pathologist when providing services or support. There are many ways that we can help our children, both at home or in the classroom, build language skills and develop learning skills. Here are some examples of ways that you can provide these opportunities at home. Provide choices. Rather than handing your child an item, give your child a choice between two items and encourage your child to use words, signs, pictures, or gestures to communicate which one is wanted. Imitation. Imitate your child's actions through play and routine activities and songs. This may help your child develop and understand parallel play and attend to what you're doing. Modeling. Because our children learn through watching and imitating, it is so important to provide communication models throughout the day, such as words, sign language, actions, or structured play. Expanding sentence length. As children become more expressive, whether it is through verbal or alternative communication devices, it is important to teach them in real time how words can be related to each other. An example of this is the +1 routine. The +1 routine increases your child's length of utterance by teaching them how to add another word appropriately. For example, if your child says car, you can add one word, red car, or cargo. This is usually an adjective in the beginning or a verb at the end. Creating communication temptations. In the preschool classroom, it's important for your child to learn how to gain the attention of a communication partner to make a request or ask for help. By creating a communication temptation at home, such as putting something out of reach but within view, your child can begin to learn to seek out help from an adult and build communication skills. Parallel talk. Parallel talk is when we provide language to describe what your child is doing during the activity. For example, while playing, you might say, "You are coloring," "put in," or "you are all done." The important piece here is to use simple and concrete language. A strategy for this is the 3-to-1 rule. It is within our nature as parents to ask questions to our children to encourage communication. We might say, "Ooh, are you eating? Is that good?" Instead, reduce the number of questions you are asking and replace them with statements. "You are eating." For every 3 statements, ask only 1 question. 3-to-1 rule. This helps your child learn by pairing language with what he or she is doing. Visual supports. Visual supports can help our children, especially non-readers, understand schedules, learn to sequence, and understand expectations. Visual supports are commonly used during ABA therapy as well as in the preschool classroom. An example of a visual support is a first-then board. This helps the child understand that they can earn their reward after completing an academic task. It can be used throughout an activity as a reminder as well. There are a wide range of benefits that can be gained from sensory play and sensory boxes. When we talk about the senses, we usually think of the 5 most common ones, including touch, taste, smell, hearing, and sight. However, there are 3 additional senses that are less commonly known, including vestibular, the sense of movement and balance, proprioception, the sense of body position, so our body's ability to sense our location, movement, and actions. And the one that is least commonly talked about is interoception. Interoception is the perception of sensations from inside the body. An example of this would be when a child is unable to identify when they feel hungry, hot, cold, or even when they need to go to the restroom. So why is this all important? During our day, we are constantly learning and taking in information from our environment and piecing it together to make new connections. Research shows that sensory play builds nerve connections in the brain pathways. It also encourages exploration and problem solving, promotes tactile learning, enhances fine motor skills, helps with impulse and self-control, helps develop life and play skills, as well as it helps build vocabulary. An easy-to-make sensory bin includes using either beans or rice and adding large scoops or measuring cups to help with utensil use. To help your child explore various textures, you can use whatever tactile items you prefer, shaving cream, gel, or whatever you have in your home, and then hide small items in them. It also helps with direction following and visual perceptual skills, the brain's ability to make sense of what the eyes see. In addition to sensory bins, you can also make sensory bags. A simple sensory bag can be made with all household items. A Ziploc bag, a gel like aloe, and items that provide a little texture like small erasers, stickers, toys, or buttons. Most can be found at a local dollar store or get creative with items you have in your home. You can make mystery bags where you hide household items in a bag, and then your child reaches in to feel for specific items, but they can't see what's inside. So you could include hard, soft, wet, smooth, bumpy, or once again, whatever you have readily available, and talk through what it feels like, either before or while searching for the object. Sensory outdoor activities include grass sensory bins, finding a favorite toy in the grass, like a puzzle piece, swinging, rolling down hills, animal walks on grass, like crab walks and bear crawls. We'll talk a little more about additional outdoor activities in the next slide. When we refer to fine motor skills, we are referring to the small muscles in the hands that help with writing, grasping small objects, and as fastening kids spend clothing. More time using technology, they're missing out on a lot of hand-strengthening opportunities. Practicing activities to help strengthen the small muscles in the hand will help with writing readiness, as well as being able to open their lunchbox or snacks at school. Suggestions include practicing games with tongs or tweezers, using Play-Doh or putty, crafts involving tearing paper, or painting with squeeze bottles. Outdoor activities include water guns, squeezing sponges, and using spray bottles. Before a child begins to write their name, first make sure they are able to complete pre-writing strokes. These include vertical, horizontal, circular, and diagonal lines. To make this fun and to help with sensory exploration, have your child use Play-Doh, shaving cream, and other fun materials to practice pre-writing strokes and keep them engaged. To help them with top-down formations, you can place a sticker on where they need to start and when they need to end. To help develop scissor skills, instead of just diving right into it, start with grasp and release, opening and closing the scissors with thumb on top. And once they have that, you can move on to snipping paper, snipping Play-Doh, and then continue to build the skill to cut lines. You may have noticed during our presentation that there is some overlap in skills being presented by our different therapeutic and educational disciplines. This is purposeful because we are working as a team to treat your whole child. We don't want to miss any part or skill that they will need in the future, and we are all stronger when we stand together to support your family. If you're looking to expand your child support team to include educational or therapeutic resources, there are many different places you can check in with. Your state early intervention program can be contacted by reaching out to your specific state office. We will also include a link to the Early Autism Services Resource Directory, which includes a wide range of medical, therapeutic, social, educational, and other resources in your area. As far as when to start building relationships with these providers, the time is now. We believe that early intervention is crucial to the success of children. We hope you enjoyed this presentation on preschool readiness, identifying and building prerequisite skills for young learners. If you'd like more information about other resources or our clinical services, please go to our website, earlyautismservices.com, or feel free to give us a call or send us an email. We look forward to seeing you soon at a future presentation.